Today is August 31st, and I'm going to be having my fusion in 2 days. We leave tomorrow afternoon, evening, because we're just driving to Valencia to stay the night up. Surgery is at 12:30. Got pre and post operative instructions, so I'm just going to read some of those. It's a very thick package. It's 4 pages, 5 pages. Okay, so pre-op. 1 week before surgery, 1 week prior to surgery, basically stop taking any anti-inflammatories, narcotics, pain medications, yeah, anything with that wonderful word, acetaminophen. I'm intelligent. Do not eat or drink anything after midnight prior to surgery. They do this with most surgeries. So bring all imaging CDs with you to your surgery if they are in your possession. Now, when I had my last surgery, I had the actual disc of my MRI. This time I do not. The MRI was taken here in town and sent down there, so I don't have it, so I will not be taking that. Okay, so right after surgery, when I'm in the hospital, pain control the first 3 days post-op is important. So they kind of list different restrictions, but basically they're going to give you stuff through your IV and they're going to move you to oral narcotics. First 3 days you're supposed to wear a sterile gauze and waterproof dressing. Do not allow, like when you're showering, do not allow water to spray directly. Do not allow water to spray directly on the incision site or area, and do not submerge the wound in water until you're cleared by your physician. Basically, don't soak in a bathtub pool for at least 3 weeks, it says. The best way for the incision to heal is to remain clean and dry. Do not apply any medications, ointments, lotions, sunblock, etc. until your doctor has cleared it. While you're in the hospital, of course, they're not going to allow you to be discharged or leave until your bladder is functioning and your bowel is functioning. And it says the best way, for this type of surgery at least, to get that going is by walking pretty early after surgery. Now, last time I walked 5 hours after surgery and I ended up having a bad reaction to the anesthesia that was still in my system. I started to pass out and I got really sick. I think I threw up. I was hazy. I can't remember, but yeah, I just remember it wasn't good. I was all happy that I was walking, and then literally 20 minutes later I was really, really sick. So this time I'm just gonna take it slow. Of course, in order to be discharged, you're going to be on heavy medication. You have just had a major surgery. You need someone to transport you home. And in my case, I live 3.5 hours from where I'm having surgery. So my grandparents, the day before, like I said, we're going tomorrow, the day before surgery, staying in Valencia by Six Flags Magic Mountain. And then we're going the next day. And then we're probably going to repeat the same process coming back. We'll probably stay in Valencia and then come back home the following day. Just that way I don't have to sit in a car for 3.5 hours right after surgery. Once you get home, somebody responsible should be there to help you for the first several days. For the first few weeks, because you won't be able to do anything completely for yourself. You'll probably be able to get up and walk, but still you'll probably need someone to help you, kind of pull you up. They want you to try and pull yourself up, but you need someone there because the worst thing to do is fall. So you need someone there with you. And they said that for people who live alone or have working individuals in their home, like husbands, wives, parents, whatever, children, surgery of all ages, they're saying that you will need a home health nurse. And so for this particular office, they said that they'll be able to coordinate that for you. But in some cases, you'll have to do it yourself. It's saying if you're experiencing a headache during the first few days of being post-op, it's best to lay supine, and if the headache comes on from that, then try moving, like either sitting up, standing up, and then if those bring it on, then try the opposite, try laying down or sitting down. It has a note saying that, of course, as most people know, narcotics are very constipating and can cause nausea and vomiting, headaches. They say for the constipation part that Duralax or Ducalax, Miralax, or magnesium citrate will help to relieve that. But then it reiterates itself by saying the best way to initiate this movement after surgery is by walking. So basically, they want you up walking a lot once you get home. And they're saying that if you do unfortunately get some sort of a cold or infection, that it is okay to take over-the-counter cold cough medication and or antibiotics. It's saying, you know, people freak out, but it's saying that inflammation is typical after surgery for the first 3 to 5 days, and also pain may even worsen in the first few days, but then you kind of hit this point past like the 5th day where you start to feel better. I know that my last surgery, I was feeling a lot better enough to straighten my hair and do my makeup, which I'm not even doing now, and have a full outfit on within 8 days of my last surgery. So I think that was my turning point. But yeah, so I'm pretty hopeful for this surgery. But to continue the instructions, ice. They said this last time, and it's the same thing continues. So ice is best during the first 2 weeks post surgery. It reduces the inflammation and is effective as like a pain remedy. After the inflammation has subsided, heat can be used, alternating with the ice. For me in particular, suture removal won't be necessary because they're going to be using the dissolvable ones. And it says do not scratch the incision. I will have steri strips. I had them last time, and they typically fall off between like 7 to 10 days. And if they haven't all fell off, then usually your doctor or your surgeon will take them off later. But yeah, they should fall off in that time. It says that the first year of your after your surgery, you're supposed to use sunblock in that area if it's going to be exposed to the sun, but not right after your surgery until it's healed completely and you have no drainage. Like, to reiterate what they said before, you're not supposed to put anything on it. Nothing on it. No lotion, nothing. I'm not 100% sure if I'll be given a lumbar brace, but it has a little section here where it says if I have it, I'm supposed to wear it all times that I'm out of bed, and to remove it before showering, sleeping. But my grandfather had the same surgery from the same surgeon, and he didn't have a brace, so I'm not 100% sure if I'm going to be having one of those. And then it says that I can start driving when I feel up to it. Of course, you should not, in all capitals, drive if you're on narcotics still. So my grandfather will be driving me for the first few weeks because I will be on heavy narcotics. As far as the first post-op appointment, you will be discussing and receive pain medication refills. You'll be discussing physical therapy, return to activity, and the expectations and the time frames and whatnot. And here it says physical therapy will be recommended at this time. Swimming, that's what I will be doing, and Pilates, core conditioning, and other non-impact exercises are ideal forms of exercise during this time. A restricted level of sex may be resumed at this time unless otherwise instructed by your doctor. And then general instructions, it just has a big long paragraph about not getting addicted to medications, narcotics, and muscle relaxants. And your goal is to wean yourself off of them. I've read many different things, and I'm typically not a pill person. I'm usually wean myself off things within a week or two. I don't like taking them because I feel like it hurts me more than it helps me after so long. So like I said, like a week or two. As soon as I can live life and function without them, like I'm off of them. But then I was doing a lot of research prior to this surgery, and some people are saying that you need to be on them for like the first month. They recommend it because they in this particular surgery, I'm having an actual fusion, and anti-inflammatories and other things other anti-inflammatories and other medications can affect the fusion rate and the success of the fusion. So I want it to be as successful as possible, so if that means I have to stay on the narcotics for longer, I will. So last time I didn't have a fusion, I had a microdiscectomy, so that wasn't a factor, so I could be on anti-inflammatories and lesser narcotics so I could wean myself off faster. So we'll just have to see. That was 3.5 years ago, so we'll see what happens. Basically, general instructions: no bending, lifting, twisting of any heavy objects heavier than a small bag of groceries, about 5 pounds. So can't lift, bend, twist anything heavier than 5 pounds for the first 6 to 8 weeks. So basically the first month and a half to 2 months. After that, you can return to some of your normal physical activity. It's recommended to wait about 6 to 8 months before returning to high impact activities and exercises, aka running, skiing, snowboarding, surfing, and weightlifting, etc. So anything like that. Basically, for the more athletic people, they're saying to wait 6 to 8 months until you resume that type of activity. So I feel for you guys, because I know people that really like to exercise and do high impact exercises. This kills them because they're just like, 6 to 8 months, what are you talking about? But gotta listen to your doctors, they know what they're doing. Typically for fusion patients, because they have artificial disc replacement patients, fusion patients, microdiscectomy, microdecompression patients, carpal tunnel, trigger finger release patients, and hyperhidrosis patients. So I'm guessing those are all the types of surgeries that these doctors in particular do. Mine is just fusion, so fusions require 4 to 6 months to become stable. Do not take any steroids, anti-inflammatories, as these medications prohibit bone formation and may result in a non-union, basically non-fusion. That's what I just gave a little blurb about, and it's right here. So yeah, they just don't want you taking that stuff because it can affect what the whole reason you're going into surgery for, and then you'd have to have subsequent surgeries and more pain, and we don't want that, so don't take them. So 4 to 6 months, yeah, I'm not going to be able to take anti-inflammatories for 4 to 6 months. Bone thinning agents / anti-inflammatories, and so aspirin, Advil, Celebrex, Calmadin, Fosamax, garlic, ginger, ginkgo biloba, ibuprofen, that's my favorite, Lovenox, Mobic, Motrin, naproxen, Plavix, Prodax, vitamin E, warfarin, and then it says etc. So I'm guessing you could always Google, what is this, and get a list of things. And it says, if you have any questions regarding medications, please seek advice from your medical doctor prior to surgery and post-surgery anytime. So basically, those are all the pre, post, at-home instructions